Welcome to Consumer Update. I'm Kelly Lightbourne. Thanks so much for joining us today. For over 20 years, Clinical Research of West Florida has been providing innovative healthcare opportunities to residents of Tampa Bay. Here to tell us more are Dr. Lon Lin and Aiden Keskiner, the president of Clinical Research of West Florida. Welcome to the show.
Thank you for having us.
So I always wonder about clinical research, and I think other people do as well, because you always think of it as a last resort, but it's not. I've learned something new by researching you guys. Tell us a little bit about what you guys do.
Well, clinical research is the process by how all new medications are approved for use by the general public under the supervision of the Food and Drug Administration. So every medication that you can get prescribed by your physician today actually went through this process to begin with.
Okay.
And
what are you really providing? Because like I said, I always think of it as a last resort, but it really isn't. It's gone through so many stages before.
It certainly has, but it's kind of a win-win-win situation because basically clinical research is an opportunity for patients to participate in a study which allows them to use medications they might not have otherwise gotten, medications that are sometimes new, sometimes we're doing comparisons, but they're also helping the country, they're helping other patients because they're actually providing the research that's necessary. They also get that at no cost to them, and sometimes they even get a little bit of help from a financial thing as far as time and travel and that type of thing. So for them, it's really an excellent opportunity.
Now I know, and like I said, I just want to debunk things right off the bat, because some people go, well, I don't want to be a guinea pig. And this isn't about being a guinea pig. Right. It's about providing an opportunity that you wouldn't have.
It's really a comparison.
Okay.
You're doing a comparison of medicine to either another medicine or a placebo. And you have to do those comparisons in order to understand whether or not the medicine actually works, how it works, and what the risks are.
Gotcha.
Right, and the idea is to improve on the current treatments that are available so that we can keep advancing healthcare for not only the United States, but globally.
Which is really huge. Now, what kinds of research are you guys doing right now? Like, what are some of the clinical trials going on right now?
Well, we are always active in diabetes and COPD for people that have emphysema and chronic bronchitis. We do a lot of lupus research. We also do Crohn's disease. And then we get different kinds of indications like frozen shoulder or opioid-induced constipation, different things at different times, but it's a wide variety of studies, and we work for a lot of different pharmaceutical companies.
And what about the medical providers? I mean, what is their history?
Well, I think that's one of the greatest aspects of our company and really sets us apart is the fact that we do have an extremely highly trained medical staff made up of nurses, other medical professionals, as well as a group of highly experienced physicians such as Dr. Lin and a lot of other colleagues that have been active in the Tampa Bay area for quite a long time, seeing patients in a private practice, as well as working with us on research protocols.
Okay, Dr. Lin, I also want to go back, because we talked about the benefit, the fact that it's free, that's a huge benefit for a lot of people, but not other people have insurance, but there's a benefit for them too. What are the benefits for people that aren't just looking for some type of a treatment because they have no insurance?
Well, it's a really nice clinical environment, which means that you're really one-on-one on the researcher as well as with the nursing staff and so forth. So there's a lot of good associated approach common to good clinical practice. You also have the opportunity to participate in what is really good medicine. I mean, it's the cutting edge of what medicine can be as well as the best of what medicine is today. And so it really is a nice opportunity.
It's like, I just kind of see it as looking into the future of healthcare, and you get to do that today, which can be a huge benefit for somebody that's facing, seriously
That's a very big
disease.
important thing because, as I mentioned to you, it's a comparison. So we're doing the comparison between what's available now, how to make that better, how can you actually participate in that, and some of the things that we find are just so dramatic. Like today in diabetes is changing so much because of clinical research. It's just an exciting area to be working in. It's just, you don't have to think that you're gonna be on insulin for the rest of your life, or you don't have to think that diabetes automatically means you're gonna gain 100 pounds. Now you can avoid that with some of the new research that's coming out. It's really exciting.
I feel the excitement. Unfortunately, people can't feel it at home, but I can feel the energy because it's got to be an incredible feeling to really help people.
It's an exciting time. There's lots of developments taking place, lots of new breakthroughs happening, many new pharmaceutical companies coming up with cutting-edge treatments, and we think the future is extremely bright for healthcare in general, as well as for the field of clinical research.
Speaking of breakthroughs, how do they find out? I know you did a quick laundry list of some of the things that you are working on now, but how would they find out what other clinical trials you guys are doing?
Well, you can visit our website at tampatrials.com. That'll give you a list of all of our active studies that are currently seeking participants. It also has more information about our company, our staff, the physicians we work with, as well as our various locations throughout Tampa Bay.
And I'm assuming they can go right online and
absolutely
submit their information.
Yes, they can, and contact us via email, phone, however they prefer.
Okay, great. A lot of great information. I think we debunked a lot of myths about clinical research, and will help a lot of people in the Tampa Bay area. So thank you again for coming in.
Thank you for having us.
Thank you.
Now, if you've got junk you want to get rid of, we got the guys who will do it. I'll tell you more when we come back.